Um, Thank you very much for your presentation, Dr. Ong. You mentioned the town of, I think it's Roches, which seemed to be bypassed by humanitarian assistance. And I wondered, and maybe I missed it, but could you tell us why and what was done to rectify this? And secondly, in all the presentations about the Philippines, I didn't hear any reference to the role of the government of the Philippines at all. And it seems to me that sort of at one end, you've got international agencies and probably some locally based agencies or representatives of international agencies who are long time in the country. And then you've got this community level, which to me is quite sort of micro to understand all the interpersonal relationships. Where is the government of the Philippines on this? I'd have thought it's a kind of a no-brainer. Where were they? What were they doing? What was their input? I would be very interested to hear what they were doing. Thank you.
Thanks very much. Let's take some more questions over here. Morris, please introduce yourself, even though I know you. Everyone else may not.
My name is Morris Herson, and I'm here as myself. I'm interested in some of the relationships between communities and individuals and agencies. There was a mention of the tightness of the community and maybe the inappropriateness of not recognising that. There was also a mention of not your word, my word, I'm afraid, I don't remember your word, bad leaders, the different quality of leaders in different barangays. I'm reflecting on experiences of my own in the past. How do you deal with that? Do you interfere in people's relationships with their leaders? Do you, if you like, encourage them to change? And that sort of is part of the whole taking action thing that Nicholas has just mentioned as well. You know, is the action that you take about changing what you do, or about changing the whole set of relationships between you, what you do, the individuals and the community? Because it is one set of relationships.
Great. And here in the front row, this lady.
Hi, my name's Carla. I work for World Vision. Wendy, you made the important observation about the slowness in which we've strengthened our accountability to communities. And Margie, you pointed to the incentive base. At the moment, it's up to us to supply accountability to communities. We set the commitments, and then it's up to us how motivated we are for fulfilling those. You mentioned that donors will help expand that incentive base, but I'm also interested in a paradigm shift towards greater demand for accountability from communities themselves and drawing on learnings from social accountability and the way that the World Bank and other institutions are increasingly engaging citizens in knowing their rights and entering into dialogue and social audits, approaches and things that we could then apply to ourselves, maybe with an independent body in the same way that we need independent people to do surveys, perceptional surveys, but yeah.
Great. Let's have one more. I'm going to take Elizabeth, and then we'll get the rest of you on the next round.
The first part of this presentation, I'm Elizabeth Blunt. I work for IRIN News. Dr. Jonathan was saying how, on the whole, people hated SMS and distant communication, and yet you seem to have been doing that without problems in Sierra Leone. Do you think people there are more open to this kind of technology? And secondly, do you think you got better responses when you asked more factual questions? Did you get your food package? Do people have enough water? Rather than what do you feel and what do you think about things?
Thanks very much. That's a good set of questions to start with. And I'm going to go to Jonathan first.
Okay. I'll respond to the second question, which is on the qualities of leaders and how to get to go around them if there are issues with local officials. So some agencies, how they went around them was actually to go direct to beneficiaries. So they did not involve the local leaders at all and try to provide aid directly to communities. And this had very negative repercussions. So local leaders felt that you were not following protocol. There were a lot of hurt feelings as a result. And communities in future interventions were actually excluded when the barangay leader, the local leader, would be the one to select beneficiaries. So we found that as a negative example. But what we found in some communities, that agencies empowered some liaisons So they selected people outside of local leadership and formal posts in government, and actually encouraged them to give feedback to agencies. So they function as a kind of more independent kind of monitors. So World Vision used their child monitors in some of these villages to relay some of their feedback to them. And that turned out to be a very positive thing for some of these communities, because they could find different people to talk to. They have at least more choices, as to who they could trust more in order to relay their feedback. So.
Did you want to comment on John Gibbs' question about the role of the government more generally?
Sure. Okay. Yeah. How national government was experienced was people felt and really were very critical of national government in relation to local government. So they recognized that local leaders were themselves affected by the disaster and were in a way more sympathetic to them and their limitations, but they felt that national government could have done more. So that's one sentiment that was very common, and people felt critical of them and much more positive in relation to agencies and their different kinds of interventions. I also wanted to clarify on the question of SMS feedback mechanisms. So I did not say that communities hated SMS feedback mechanisms. In fact, they actually used SMS feedback mechanisms to relay a more confidential and set of comments and requests. So those feedback which are a little bit sensitive to communicate face-to-face and they want to be anonymous, they would be using SMS feedback. But for general issues around beneficiary selection, they would prefer to do it face-to-face so that they could appeal to emotions as well of agency workers.
Thanks very much, Jonathan. Let's go to Margie next.
Yeah. So let me pick up the Rojas City question. So the agencies were very clear that Rojas City had not been as badly affected by the typhoon as the neighbouring rural areas. And so, therefore, in terms of being needs-based, they excluded Rojas City. Now, in our research, we weren't in a position to be able to assess whether that was an appropriate decision or not. But what we were able to come to the conclusion about was that there'd been a real lack of communication to the people of Rojas City, so they didn't know why they'd been excluded. There'd been no communication. And when you read the full report, you'll see, rumours started to flourish as to why people had been excluded. Really quite unhelpful rumours. So that's what I want to say about Rojas. Just very briefly on the government, any of you who have had a chance to look at the interagency evaluation of the typhoon, of the Haiyan response, will see that the international response was quite heavily criticised in that for working very much in parallel to government. So at the local level, that was probably much less the case at the barangay level, as Jonathan's mentioned, but at the kind of higher level, for example, government officers were quite rare attenders of working group meetings, and they said, there's all these meetings all the time, we don't have the capacity to be collaborating with agencies in the way that agencies are collaborating with each other. And just one other thing I want to just pick up, I think, on your point on incentives and a paradigm shift so that there's a demand for accountability from affected people. I think that's where understanding the cultural context is absolutely critical, because I think, as Jonathan's explained, there was this reluctance to hold agencies to accountable in the Philippines culture unless a relationship was established with those agencies where people then felt that they had a strong enough relationship. If they were critical, the aid wasn't going to be withdrawn, and they felt that agencies genuinely wanted to hear their views and hear their experiences. But it was understanding that context in order to know, how to encourage people to hold agencies to account, I think is absolutely key.
Thanks very much, Margie. Nicholas.
Yeah, Elizabeth's question on the SMS thing. I mean, we've heard a little bit more from Jonathan, but certainly in a place like Sierra Leone, there was very little alternative to using SMS. I think one point that's really important to make is that if you could get a cold call SMS, so to speak, or a cold SMS, you're much less likely to respond in an open and candid way. So it's very important to kind of communicate ahead of time to explain to people why this SMS is going to be arriving, how the information is going to be used, and also trying to use communication to relay back to people what you've heard and what is going to be done with that information. So just extracting data through SMS is a very ineffective way, as ineffective as other forms of extractive data gathering. So very important. The other thing is one also offers an incentive to people to provide feedback. A very small amount of money is sort of put on their phone, credit on their cell phone, so they have an incentive to complete the survey. And these surveys are very short. They're 5 questions: yes, no, no opinion. And so they're very quick to do. I think it's a very different story if you have a lengthy SMS survey. Then you'll have very much more trouble in getting honest or getting useful responses, because you won't get that many completed surveys. Second point is your point about perceptual versus factual data. We find that the perceptual data actually surfaces all kinds of interesting issues you can then plunge into with more factual follow-up. Sierra Leone's a very particular case. Central to our methodology is actually following up and asking people, when you do this face-to-face, which we do in most instances, why did you score that statement as you did? Why did you answer that question as you did? And then people tell you why they said, I totally disagree with the statement that I feel safe in this place. And then you get some factual data that you can begin to use to make them feel safer. So I think that's the perceptual data gives you a really useful starting point. It's not an end point. And the way we did it in Sierra Leone was because we didn't have the opportunity of following up in that way. We launched subsidiary or additional surveys, and there we asked factual questions. So the people in quarantine survey was we asked factual questions. We also then started with Plan International a survey of people whose homes had been decontaminated after some family member had the disease, and we also asked them factual questions about how the decontamination process had gone.
Thank you very much. I am going to take a question from Rachel. And I've got 4 questions online, which I want to deal with, and then this person over here in the front row.
Thank you, everyone. I'm Rachel. Oops, lost my question on the floor. Rachel Hatton from the CDAT Network. First of all, I'd just like to thank the team for this excellent study under Alex's leadership. I think that the inclusion of the anthropological framing was really excellent and actually really helps us unpack what we understand by accountability. So thank you for that. I think it really sets a standard for us. I'm interested to know what agencies see or saw, and this also, I think, applies to Nick's work, as their accountability responsibilities at programme level. I've for a long time thought there was a mismatch between global standards and field level actions, and I wonder what the panel thinks, or what degree you think the new CHS, the new core humanitarian standard, will actually address this. And then 2 sub-questions. How integrated was accountability into agencies' programming in terms of how they understood this at the level of activities required? And thirdly, what kind of information did agencies communicate to the population as part of their accountability commitments?
Thanks very much, Rachel. And then Scarlett over here. And then I'll come on to our online participants.
Hello, I'm Ruth Jacobson. I've been researching on gender and conflict and humanitarian emergencies for some time. And the issue of gender disaggregation of data is, of course, one that's very familiar. So I was a little bit startled to find Marty saying about how it appeared that some of the information that had been recorded had not been disaggregated, and not either by ethnicity or age or other issues. With that in mind, could I ask Nicholas about his methodology? It may well be covered in the full report, sorry. You refer to frontline workers, people. Would you care to elaborate on that in terms of gender disaggregation? Because it seems to me it would be possibly, one doesn't know until there is the evidence, quite interesting to see if there were different perceptions from male and female informants in those categories. You did mention about harassment as well in GBV, but I'm not interested simply in that aspect, but in the whole issue of being able to actually disaggregate by gender and possibly by cross-reference by age. Rather a lot, I know, thanks, but if you could summarize it.
Thanks very much. Okay, I'm going to just read out some of the questions from our online audience. In fact, we've got 2 questions from one person, and apologies in advance for mispronouncing people's names. I think it's pronounced Uwe Chorus, who's from CARE. And Uwe says, regular stroke robust data collection from affected people requires early and sustained investment. What would be the recommended resource mobilization model stroke strategy to ensure that the appropriate capacities and systems are put in place in time? And then I'll just read the second part of Uwe's question. Third-party mechanisms are used in remote monitoring mechanisms, such as for inside Syria, and I think this is the context in which Uwe is working. What lessons can be learned from those experiences that would allow for developing key principles for third-party based stroke-supported accountability mechanisms? Was that clear? Yeah? Okay, and moving on, we've got Nicholas Fermanet from Oxfam Intermon. Nicholas says, the panelists have referred to the importance of separate teams within organizations or even third parties to champion questions of accountability. But do we have any examples of good practice where implementing teams adequately engage with affected populations? Or is it a lost cause? And then finally, in this round, Emily Rogers from the British Red Cross says, increasingly, AAP is becoming equated with feedback mechanisms and communication, and seems to be overlooking aspects such as participation, particularly in decision-making. It would be interesting to hear if there are findings from the Philippines on participation of people at barangay level, including who agencies worked with and the quality of this participation. And I would imagine likewise in the West African context. So I think that's enough for you to be getting on with, and I think we'll start, if you're all right. You want to go this end, or?
Yeah.
Okay, Jonathan, it's down to you again.
Oh, okay. Okay. First, the question on gender, where I'd like to share with you from the Philippines experience, it was actually mostly women who were very much active during distributions and beneficiary selection. So low-income women were actually most visible in these distributions, and they would keep tabs as to the schedules of these distributions more than men, as men were much more tasked towards finding an income and finding a living for their families. So this also translates to feedback mechanisms, such as community consultations, which were attended mostly by women. And we found that agencies tried to cultivate this relationship with them and try to encourage their participation. So in some of these distributions, there would be a queue specifically for women and encouraging their support and their more active participation in these events. And so that's something that we found was a positive example. In relation to accountability and accountability officers, and what we really found was that different agencies had their local accountability officers differently empowered. Some would actually be very much dependent on their program leaders to dictate how conduct of targeting would be and how the programs would actually be changed or not. Well, some accountability officers had a much more robust relationship with some of these program leaders. And so in that sense, there is a diversity in terms of how agencies empower the local officers in terms of analyzing and providing these recommendations. In one of the agencies that we interviewed, however, it was quite striking how she told us that when it comes to her recommendations, when she would send them to the national level, she would never really hear back as to how the recommendations were taken up. And so when there's a new program to be initiated, she has no idea whether it actually was a result of something that she had initiated and recommended several months ago. And I think that's quite striking as an example, and we're quite anxious about that.
Great. Marky.
Okay, thank you. I'm going to try and answer two or three together by looking particularly at this issue of where agencies did seem to really take on board a kind of culture of accountability and of listening to affected people. It's like, what did that look like? What was different in those agencies? And I am talking, and I'll be very clear about that. I'm talking quite a lot about World Vision because they did make a lot more progress than many other agencies in the high-end response. And they would be, I don't know whether we've got anyone from World Vision here. Okay. Certainly the World Vision staff on the ground would be the first to say, and it's no guarantee that we can replicate that next time, but I think there is a recognition that they did do it very well in the high-end response. And what it looked like was senior managers who were not prepared to make program decisions until they had information back from the community level, even if in the very first few days that was quite rough and ready information, but nevertheless it was, that they were modelling a way of taking decisions and a way of prioritising on what basis they were prepared to make decisions, which I think was very important. They also did things like they had issues around feedback from affected people on meeting agendas, weekly meeting agendas, monthly meeting agendas. So it was a standing agenda item. So again, it's sort of apparently small things, but I think things that can make a real difference in terms of demonstrating what is it that really matters, what are we going to base our decisions on. And nevertheless, despite, I think, doing a very good job, they would also say, they have said that they had an internal, although semi-independent audit of their work, which threw up things from the affected people that they didn't know about, despite the fact that they had a stronger culture of listening to people than many other agencies. They, I think, and I'm hoping some of them might be online, would actually say that it was actually very important to get that independent feedback as well. So it's not in calling for an independent third-party body, it's not to say that agencies can't do it themselves, but I think there's a value in having an independent third-party body that comes in without an agency hat on. And I'm even aware of that in, say, the way that we've worked together. As Wendy said, I've worked in the humanitarian sector more years than I probably should have done. But I will hear things in a certain way as a result of that. And I think Jonathan and his team heard things in a different way because they're not steeped in the sector. They're not asking questions in a certain way. And I think that's one of the values of having independent work. And I think, as Rachel said, there's a huge need for much more anthropological input. And, I mean, there was so many questions there. Somebody asked about capacity and systems. And I think I'd want to also make a distinction between what may be possible and feasible in the early days or even weeks of a response and what's possible later on. So I think this is where the use of PDAs was actually played quite an important role when agencies were having to make decisions very quickly, they were having to get assistance out very quickly. They could do quick post-distribution monitoring surveys, for example, where using PDAs, the data was very quickly transferred back to their offices. They could get a very quick picture of what was going on. But that's not good enough for the entire period of the response. That has to be backed up by much more detailed and in-depth community consultations, talking to affected people, as the initial kind of emergency subsides. So I think what's appropriate at different phases changes, but the culture that mustn't change is that we shouldn't be making decisions unless we're hearing back from affected people in one form or another.
And some of the early work that Barb Wigley spearheaded maybe is interesting, because that's even prior to distributing anything.
Exactly.
I mean, that's really looking at getting agencies together to ask people what they were really expecting and what their needs were. And my understanding was that showed some positive results. Nicholas.
Yeah, I mean, there's lots of questions here, and we probably won't cover all of them, but one of the questions that you asked, Rachel, was about the common core humanitarian standard and the difference that's going to make. I think the core thing about the core humanitarian standard is the verification guidelines, which really place the emphasis on how these 9 commitments are perceived by people supposed to be sort of at the receiving end of aid. And I think that will have, talking of incentive structures, that's going to be really important in building an incentive arrangements that will push this agenda forward. Another question you asked, and it links into some other things that were being said, was how seriously do agencies on the ground actually take this agenda? How robust is their response? And the last time I was listening to a conversation like this was I was on the other end of a telephone listening to a webinar organised out of Geneva, where Toby Lanza, who's the humanitarian coordinator in South Sudan, was
Until today.
Until today. Well, he was still there, and he was sort of saying, he was being asked about the importance of this agenda in South Sudan. He said, yes, it's very important. Everywhere I go, I tell people they need to do more of it. And then he was saying, the problem is I don't quite know what it is. And so that is, I think, an enormous problem. It's sort of unpacking and then repacking this agenda so that it becomes something that people on the ground can wrap their arms around and do something about. And I think actually in the last few weeks, interestingly enough, with actually CDAC's lead, we have created in Nepal and DFID support a common platform which brings together many of the pieces of the accountability puzzle and puts them there at the service, if you like, of the overall response, rather than having little bitty pieces trying to sort of work their way in isolation. And I think the person who called in with it, or who came in with the question from the outside about this is not just about feedback mechanisms or communication, there's a whole kind of middle ground. Of course there is, and that's absolutely right. And we need to make sure that we come up with platforms which offer the sort of full range of services to a response. And that, I think, comes back to another question that was raised about how, from Yue, who came in with a question from outside, how to put in place the right arrangement so that donors can do something about it. At the moment, sort of, we go to DFID with our small thing, and then we have to be piggybacked on something else. If we can come up with a kind of an accountability platform or a community engagement platform, we have organizations which are kind of ready and rearing and experienced in working together, and then we can go to see a donor. That will make it much easier to get things going at the right moment. Oh, and on the question about, yeah, absolutely, gender disaggregation. We always try and get a balance between males and females and different age groups. It's much easier, of course, when you're not doing it via SMS, although we do try and do it when we use SMS. But most of the time, we're doing data collection face-to-face, and then we're very specific in trying to break it down by age, by religious, by religion, by membership of different social groups, and so forth and so on.
So your primary data would indicate whether the field worker was male or female.
Oh, that definitely. Sorry, yeah. That in that instance, you would know what gender the field worker had. Yeah.
And is that available?
Yeah, absolutely.
For the online audience, if you couldn't hear that, the question was asked about the primary data and whether that's available and whether it reflected those differences. And Nicholas has said yes. So. Right. Well, thank you for that. We have 15 minutes left or so, and we'll take a couple more from the audience. And I have 2 more online. So let's see. This gentleman in the first row.
Thank you for the most insightful presentation. My name's Phil Randal. I'm with Save the Children. I spent 11 months in the field working on the high ant response, but unfortunately in Eastern Samoa, where you didn't visit. But with a different agency, I should mention, who was part of this research. Much of what you said certainly resonates with me. I was responsible for the programming there. Two things I think to so some comments and a quick question as well. Two things, I think. One is time. The time constraints for ensuring, and this would change at different stages of your response, which you alluded to, Margie, to ensure that we have got comprehensive consultation, and then also taking, we talked about feedback, but going back and actually talking through why we're making changes to the programs or why we're not, and we've listened, and so it's those continual loops. And again, time for that. The time constraints put on us by donors. Many donors are accepting of delays and so on, and if you have that dialogue, but there's pressures internally to say, well, there's a deadline, make it. So which battle do you fight? And then and then there's the power dynamic as well, I think, which is important. So even between barangays, you've got some barangay captains, they're the local government leaders that we're just talking about. There's definitely some kind of co-option of aid there, and they've got the interests of themselves and their families. Others very much for the community. So those power dynamics within the community takes so long to really understand. So having an anthropologist or having that first and foremost in your response, I think, would really benefit many agencies. So just a quick comment. My two questions. One, seeing the trends, Nicholas, from your work in Ebola, do you think in the Philippines we may have seen different results had you asked these questions at different periods of time in terms of how, that's my question. And then secondly, what do you suggest, if anything, we can do as a collective? Because much of the messaging, the feedback we would get would be from other agencies. Well, that's great, but these other agencies have said this or this. And then how do we ensure, okay, we feed that back to another agencies, but then closing that loop and ensuring that we all act as one big group? There's some very big agencies out there doing a lot of work, and there's different pressures. And so unfortunately, I think the solution really needs to be as a collective. So any suggestions for that?
Let's see, we've got so many questions. Let's go with two people here, if your questions are very quick, and then we'll move over to this side.
Hi, thanks for the presentation. And my name is RB Bagios. I work for the British Red Cross in our Philippines response. One of the recommendations of the research in Philippines was it's more important to focus on building relationships rather than feedback mechanisms. From what I understand, though, feedback mechanisms are set up so that responses are standardized and sort of like more transparent. So my question is, do you think that there are also accountability risks in an approach of building relationships? For example, could that be could relationships among crisis-affected people and aid workers be perceived as, I don't know, favoritism or patronage? Or could it lead to crisis-affected people having more debt of gratitude towards aid workers whom they have relationships with, and therefore they're not able to provide more honest feedback? So that's my question.
Yes, and then the gentleman next, just very quickly.
Quick question, Tom Pilcher, FCO. Is it helpful for agencies to think of conflict-affected peoples as customers? And is there room for a more mutual relationship, such as a partnership where there is shared accountability?
Okay, thank you. I'm going to go to the online questions first, partly because those of you who are in the audience who have questions can actually have access to the panelists afterwards. So let's start with Sarah Mace, and I'm really glad you're online, Sarah, because I want you to write an article for the next issue of The Exchange on Iraq. And Sarah says, I'm leading the establishment of an interagency feedback and information provision service for all IDPs in Iraq. Working in a conflict situation, including when you're getting feedback from areas without humanitarian access, creates many challenges. Expatiation management, if I got that right? Expectation, yeah, it says expatiate, it must mean expectation. Management is key for what we can provide after feedback is received. Can the panel comment on how this impacts the success or failure of a response, and can you offer any advice? So that's a challenge. And please do get in touch, Sarah. And then we've got Olivia Wilkinson from Trinity College Dublin. Olivia says, what's the role of local staff members in accountability mechanisms? And how can they be further supported? It seems there is an over-reliance on local staff to bridge gaps between cultures, and they're at the front line of accountability. And then we have Ala Jorna, who is with CRS, who says, thanks for the presentation. I just would like to know how to ensure community engagement and participation of crisis-affected people in areas which have civil wars, and to what level can you do this? So a different context from the Philippines, which is different again from the Ebola crisis. So let's start with those, and if we have time, we'll move to the others, and if not, I urge you to talk to the panelists afterwards. Shall we go in reverse order this time? Nicholas? Yep. You're always in the middle, Margie. I hope that's okay.
That's fine. I'm fine with that.
Yeah, I mean, I totally take the idea of some kind of collective endeavour, I think, makes an enormous amount of sense. And I think we should be moving in that direction as fast as we possibly can, adding sort of bells and whistles to it, but there should be a strong collective platform, if I'm answering your question correctly, and I'm not sure I am. Time series data, my position on that's pretty clear, I hope. Sarah's point, the shared accountability, I think this is a really important point. The idea that the idea is sort of how do we move towards co-management of programs, and that must be the kind of the end game that we're working towards. But what we're, I think, discussing today is a significant way station on the way to that distant horizon. But I think that must be what we're kind of after in the long run, and hopefully what we're doing will help us slowly get there. Sarah Pace's point about expectation management, and she's talking about a very specific context where it's very difficult to get close to meeting those people's expectations because they're in conflict zones, and all of that makes it that much more complicated. But in other circumstances, I've also heard people worry about whether or not we're not giving rise to sort of, by talking to people, are we inflating their expectations? But that seems to be a bit of a cop-out, basically. And the thing to do is to have a form of engagement which allows people to interact, to have dialogue, to understand what their rights are, what agencies can do for them, but also what the constraints are on what agencies can do, and there are many constraints on what they can do. So I think what we're really talking about is how do we develop a strong dialogue where people understand each other better. Expectations are created and not met in the absence of that kind of dialogue. So I think we need to be moving very firmly in that direction. I think I'll hand over to others.
Thanks very much, Nicholas. Margie.
Yeah. I want to make a really clear distinction between our research findings in the Philippines and what may be possible and appropriate in conflict environments. There's such different contexts. So you'll see in all our reports, we try and make that caveat. I think we'd be very alarmed if anybody thought that the findings from the work in the Philippines could just be somehow replicated or kind of moved to a different context. And I think we're probably in need of a lot more understanding of what is possible in different conflict environments, and every conflict environment will be different as well. So I think it's just important that we do really give context the respect that it's due. I wanted to pick up also on this. Is it helpful to think of people as customers? I think it was, yeah. I think certainly in the Philippines, it came out as that was very inappropriate. And I think what we need to remember is, I mean, by definition, in humanitarian crises, we're dealing with people who've been through a lot of trauma. They've lost loved ones, they've lost perhaps their houses, their livelihoods. And I think there's something about going back to the basic values of what humanitarian assistance is all about. And I think it came through very clearly in the Philippines that actually our slightly market-oriented terminology actually wasn't very appropriate in that context. Maybe it's more appropriate in other contexts. I mean, that's to be seen. But I think we do have to remember the people that we're there to support, and what is appropriate in those situations. And then let me pick up something. I think somebody said something about donors and donor time pressures. It was very interesting because we did ask a lot of agencies if they felt that it was donor pressures that stopped them somehow being accountable to affected people, and certainly in terms of adjusting and changing their programs according to what they heard. We got quite mixed results. There were some examples where people said we went back to the donor and they said we couldn't change our program, even though we knew that it was no longer appropriate. But actually more common was the donor was prepared to change the program, but they took forever to give us the final answer. And that was a disincentive in itself, because if you went back, you might be waiting another 2 months before you could actually try and implement a slightly adapted program. So there's some nuances there, I think, in terms of the donor-agency relationship.
Did you also hear, Margie, I remember we had a discussion with one donor who said, well, actually, I didn't receive any requests. So I think there are possibly instances where agencies were making assumptions that they weren't going to be able to make changes and didn't actually explore it to the extent that they could. And I would say on the customer thing that do people really have a choice in most cases, as customers are meant to do? So that's something else to possibly bear in mind. Jonathan, you have the last word.
Okay, great. Well, thank you. The question on feedback mechanisms and how it would actually relate with more personal interactions and the meaningful relationships of face-to-face. We're worried, and here I speak also on behalf of my humanitarian technologies project team, where we're a team of academics also looking into technologies in their role in disaster recovery. We're quite anxious as to this increased fetishization of technology, that there's a celebration of these new tools, that they will immediately empower people, that they would facilitate voice of affected people, that it would guarantee accountability. But in the Haiyan case, we see a great amount of investment for accountability teams. So local groups, teams at a local level having a concerted team just to collect feedback and respond to them. But in terms of the kind of results and outcomes that affected people have, they're very limited in terms of what kinds of changes were actually implemented. So we're a little bit worried about that, how technologies are seen as this kind of magic solution into improving accountability and voices of affected people. Where I think we see technologies work if there's that interpersonal dynamic as well, where there's meaningful relationships facilitated by people on ground who actually spend time with communities. And not just one person on ground, but also a team of people involving people from the community themselves, but also independent people from different groups and from the agency itself. So I think that kind of culture of accountability is sometimes lost and sidelined in relation to celebrating these tools. And I think Barb Wigley has also written about this for your report.
Yes, I have to put a plug in for the Humanitarian Exchange 63, which was on the Typhoon Haiyan response. And please look out for the next one, which is on the Ebola crisis. But I'm afraid we're out of time now, but I would like to thank our panelists for the really interesting presentations and insightful answers to the many good questions that we had, and to thank all of you and the 250 people now who are participating online. So there's a huge amount of interest in this topic, and let's hope that we're able to make swifter progress and better progress from here on out. And I'd like to also say that a video of this session will be online within a few days for those of you for other people that weren't able to attend, so let people know. And please join us for refreshments and networking just out here. Thank you very much.